Are you new to dialysis, or are you on dialysis and your machine goes off and you don't understand what's going on when your technician or nurse reset the machines? Well, I'm going to go over 5 alarms that you should be aware of and that you should know, and when these alarms goes off, what you should look for. So, with that being said, I'm going to start off with know your KT over V. Are you getting enough dialysis? Share this video if you know anyone who can use this information. Please share it, share. Um, we need many kidney warriors to know what's going on with their treatment. Okay, KT over V. That's K as the letter K, T, and then you have a slash and a V. Okay? Now, why do you need to know what the KT over V is? KT over V is a test that determines if you are getting enough dialysis treatment, point blank. With adequate dialysis, you feel better and you live a lot longer. Okay, so I'm going to break down what these letters mean in KT over V. Okay, let's start with the K. The K is how much urea or waste is removed by the dialyzer. Okay, the T equals time, or the number of minutes you are being dialyzed. And then the V is the volume of urea in your body. For instance, in your blood, urine, and body fluids. So, a KT over V of 1.2 or higher means that you are getting adequate dialysis. Now, let me repeat that. A KT over V of 1.2 or higher means that you're getting an adequate dialysis session. So, what happens if you're not getting enough dialysis? Okay, I want to tell you. If your KT over V is below 1.2, over time, you may feel sick, have less of an appetite, nausea, or vomiting. Okay, you may also have problems sleeping at night. So, with a lot of warriors who say they had trouble sleeping at night with insomnia, that may be something you want to look at. What is your KT over V? Especially if you have a catheter. Very important. Okay, what can happen if you're not getting enough dialysis? Fluid can build up in your lungs, feet, legs, making it hard to walk. Fluid overload can also make you feel short of breath and tired. Okay? You may start to feel depressed as well. All these toxins building up because you're not getting enough treatment. Confused or forgetful. These are some of the signs of not getting enough dialysis. Feeling depressed, confused, or forgetful. Some people may call a dialysis fog. Without enough dialysis over a period of time, there's a higher risk, okay, of hospitalization or even death. Now, this is with the over time, like not going to treatment for a month or 2 months or weeks, okay? How can you make sure you're getting enough dialysis? Okay? How can you make sure you're getting enough dialysis? Because, look, they go over this with you each month, the dietitian and the nephrologist. You may be there, you may not be there. You may be asleep, you may not be asleep. A lot of things come into play. You may be awake and be aware and understand and go with the suggestions and advice that they recommend. That's what you're supposed to do. But you have a segment population of patients that just can't get it. Okay. And there's no fault of theirs, be it lack of education, just lack of knowing medical jargon, um, being overwhelmed, stress, whatever the case may be. And they may not understand it. So that's why we're here doing these programs, soon to be coming on WKN, okay, through Urban Health Outreach Media. So, how can you make sure you're getting enough dialysis? One, be sure to be on time for every dialysis session. Missing only 5 minutes of each treatment for 1 year adds up to 3 whole missed treatments. That's 1 week's worth of treatment. Okay, 5 minutes. Missing only 5 minutes of each treatment for 1 year adds up to 3 whole missed treatments. Okay, if your KT over V is less than 1.2, talk to your doctor about what needs to be done to improve it. Okay, just don't say, okay, like if your KT over V is 0.8 or 0.9, that's clearly not even meeting the average of 1.2 or higher. So you're going to probably feel like crap because that is a low KT over V. Okay? Talk to your doctor what needs to be done to improve it. You may need tests to check your fistula or graft to see if it's working well, or you may need a higher blood flow rate. Just something simple is turning up the blood flow rate from 350 to 400 or to 450. Take good care of your access. Okay, we talked about that the other day. Some access, look, listen, and feel. Check with your nurse or PCT to make sure that your machine reaches the prescribed blood flow rate. I talked about that many times, and checking your machine, making sure you're running on the exact blood flow rate that your nephrologist prescribed for you. Now, you have to know what it is. If you don't know what it is, you won't know if you're running on the prescribed blood flow rate. So know your orders. Know what size needles. Know what blood flow rate you're at. Know your dialysate flow rate. Know how much heparin you get. Know your dialyzer size. Just know your blood pressure pre and post. Know what your temperature is. Know what your treatment is. Just don't go there and let them do it and not be aware of what's going on. Okay, now for the people who have catheters, if you have a catheter, talk to your doctor about having a fistula or graft placed for better dialysis. I know you don't want to hear that, but the sooner you get that catheter out, the better you're going to have higher KT over V numbers. Blood flow rate must be slower with the catheter. Sometimes your catheter can't reach 400 to 450 blood flow rate. And last but not least, talk to your dietitian in the unit about changes you can make in your diet to prevent fluid overload. So that was the Know Your KT over V. Are you getting enough dialysis? Okay. I hope you was here to hear that segment. I'm about to transition to the second half of this education moment, machines and their alarms. But before we do that, let me bring you a Urban Kidney Alliance kidney disease PSA. Please enjoy it. Okay, welcome back. Welcome back to the second half of the kidney disease education moment. I am your host, Steve Belcher, Executive Director of Urban Health Outreach Media. Now, in this second half of this broadcast or this education segment, we're going to talk about machines and their alarms. How many people been into a dialysis center, okay, for more than a few minutes, and then all of a sudden you hear beep, 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 all these alarms going off. I mean, you cannot go into a clinic without hearing these alarms. And some people look at these alarms bewildered, especially some new kidney warriors who just started. The alarm goes off and they're looking up like, uh-oh, what's going on? Well, one, you can always ask your hemodialysis care team what exactly is going on. I was going to say a cuss word, but I held it. But you can ask them what exactly is going on. What is that alarm? Why is it beeping? So I'm going to give you 5 of the main alarms that you may hear. There are a lot more, but these are typically like the 5 that you're going to see on a continuous basis, okay? Number 1, the arterial drip chamber pressure alarm. Again, the arterial drip chamber pressure alarm. So let me tell you what that is on the machine. The arterial drip chamber is located between your arterial needle. Listen, if you're on dialysis, please listen. I don't have a picture of a machine to show you, but I want to try to be as detailed as possible so when you go to dialysis tomorrow morning or Tuesday, you can see this for yourself and observe it. Okay? So, the arterial drip chamber is located between your arterial needle and the blood pump. If the blood pump is programmed to pull blood up the arterial line faster than what your access is providing, the pressure inside this chamber will drop. I want to repeat that. This is very important because a lot of warriors, you may have heard the term, my arterial needle is going negative, or the chamber is dropping. If the chamber drops, you can get air in your lines, okay? So let me repeat that. If the blood pump, which is the blood flow rate, is programmed, and the way it's programmed is either by the technician or the biomed person to pull up. Okay, let me repeat this. If the blood pump is programmed to pull blood up the arterial line faster than what your access is providing, the pressure inside this chamber will drop. Let me give you an example. If you just got if you just got a fistula, an AV fistula surgery, that's why we start you off on 17 gauge needles, because your access is not developed enough to handle that blood pump. That's why we start you off at 200 to 250 blood flow rate, because your fistula is fragile. It's maturing. And that's why we have you do the exercise and squeeze in the ball. Okay? So if you just started using your access and they crank that blood pump up to 350 to 400, one, it could possibly blow your access, okay, because of the speed coming back into the venous can give you a infiltration. Or, as it said, if the blood pump is programmed to pull blood up the arterial line faster than what your access can provide, the pressure inside this chamber will drop. This in turn will cause an alarm to sound for your protection. The blood pump stops. When the blood pump stops, your treatment time stops. A lot of people didn't know that. So you could go on dialysis, look at your watch, and see a time that you went off, and you count 3 to 4 hours from the time that you saw on your watch. And then when that time comes up, you see you're running 5 to 10 minutes longer. Well, every time your machine stops, the time stops. Okay? As it says, this in turn will cause an alarm to sound, and for your protection, the blood pump to stop. Access flow issues or movement of the access arm are common reasons for this alarm. Let me repeat that again. Access flow issues or movement of the access arm are common reasons for this alarm. Please share this video. Share this video. WKN on Urban Health Outreach Media. The second alarm, just like the arterial alarm, you got a venous drip chamber pressure alarm. This is the venous chamber. This drip chamber is located between the dialyzer and your venous return needle. Anything that impedes the flow of blood below this chamber will cause the pressure within this chamber to increase, and an alarm will sound. Okay? An infiltrated needle, okay? An infiltrated venous needle at that, a kink of the venous bloodline, and a clot formation within the venous chamber are 3 possible reasons for this alarm to sound. I hope you got that. An infiltrated venous needle, a kink, all right, a kink of the venous bloodline, and clot formation within the venous chamber are three possible reasons for this alarm to sound. So if your machine goes off, one, ask the technician or nurse when they come and reset it, what alarm was it? Was it the venous or was it the arterial alarm? Okay. Number three, air and blood alarm. That's very important. I cannot stress this enough. Air and blood alarm. Okay. An air bubble sensor with a venous line clamp is located below the venous drip chamber. If air bubbles are sensed in the blood, let me repeat that, guys. Air bubbles. This is how serious dialysis is, that they got an air and blood alarm, meaning that air could get in your blood. That's why they have the alarm. And this is why you have to be mindful of your treatment to know what's going on. Air can get in your blood many ways. A technician can leave the saline bag open when you go on for treatment and not clamp it when they're giving you fluid for cramping. They can inject air in there through a syringe. Any way air can get in your line if your drip chamber falls, okay? The arterial or venous. This stops the bubbles at the point and prevents the air from entering your bloodstream. So if air bubbles are sensed in your blood, okay, the line clamp closes immediately. This stops bubbles from getting into your blood. However, some technicians and nurses forget to put the line that's supposed to be clamped in the clamp. So you gotta know what's going on with your machine. Is the line inside the air detector? So if the machine stops, it clamps the line. Okay. The next one, temperature alarm. Very, very important, because if your temperature is high, and I'm talking about the machine temperature, and the machine is broke, it can cause your blood to have hemolysis or crenation. It can destruct your blood cells. That's why you got to know this. The temperature alarm. This alarm monitor measures the temperature of the dialysate. That's the bath. A clear electrolyte solution before it enters your dialyzer. Let me repeat that again. This alarm monitor measures the temperature of the dialysate, which is the clear electrolyte solution, in turn, which is the bath used to clean your blood, before it enters your dialyzer. This monitor is located inside the machine, and if the temperature reading becomes too high or too low, an alarm will sound and the dialysate flow to the dialyzer will automatically stop. The machine will go into bypass. Your doctor orders the temperature setting that is appropriate for you. Okay, typically it is 36 to 37 degrees centigrade. Okay, let me repeat that. With most machines, like the Fresenius and other machines, they show you what the temperature is. Okay, guys, it looks like I may be back. If you're still here, thank you for watching. I mean, this is live, man. I cannot explain this anymore. I'll wait for a minute for some people to come back on this broadcast, uh, so you can get the rest of the information. Again, sorry for the technical difficulties. Let me see. I'm gonna wait for a minute to see if some people still wanna come on here. Let's see. All right, all right. Before we go back to that, let me just give you a quick PSA.
Do you know you could have kidney disease and not even know it? 9 out of 10 people who have stage 3 chronic kidney disease do not know it. The rate of kidney failure for African Americans is 3 times higher than among Caucasians. And one reason for this is that they are not aware when they have earlier stages of kidney disease, at a time treatment could prevent the damage from progressing to the point when dialysis or kidney transplantation is necessary. In addition, due to high rates of diabetes, high blood pressure, and heart disease, blacks and African Americans have an increased risk of developing kidney failure. African Americans need to be aware of these risk factors and visit their doctor or clinic regularly to check their blood sugar, blood pressure, urine protein, and kidney function. Be aware. Get tested. The life you save may be your own. For more information, contact urbankidneyalliance.org.
Okay, guys, I'm back. So, look, I was halfway through and the broadcast went off. So, what I'm going to do is finish up and then expand on what I talked about. Okay. So before this broadcast was interrupted, we were talking about machines and their alarms. One of the alarms that I was speaking on is the temperature alarm. This alarm is a temperature on the machine while you're getting dialysis, and it regulates the temperature. This alarm monitor measures the temperature of the dialysate, which is the bath that is used for dialysis. The dialysate is just a clear electrolyte solution before it enters your dialyzer. So this monitor is located inside the machines, and if the temperature reading becomes too high or too low, an alarm will sound and the dialysate flow to the dialyzer will automatically stop. The machine will go in bypass. And even when it goes in bypass, again, you're not getting the treatment. So that's why you need to know, because you can have two different times on these machines. They have a UF time and an RTD time, real time dialysis. And basically, these two times should match up. So if your UF time is the time of the UF, which is the ultrafiltration that's pulling the fluid off. So if you stop pulling fluid, you're stopping the UF time, okay? But the RTD time, the real dialysis time, is still running, okay? Now, your doctor, as I was saying before, your doctor orders the temperature setting, or some units just have a protocol, okay? But normally the temperature is normally set between 36 and 37 degrees centigrade, which is more or less close to your body temperature. So that's why they have it like that, okay? Now, the last alarm is the conductivity alarm, which is a common alarm, and that happens a lot of times when the bath or the solution runs out or air gets into that line, and it drops the conductivity. So this alarm monitor measures the electrolyte concentration in the dialysate prior to it reaching the dialyzer. If, for example, a dialysate concentrate jug, which I was just saying, a concentrate jug should run dry during the dialysis treatment, the conductivity monitor will cause an alarm to sound and the flow of the dialysate to stop, protecting you from an inappropriate dialysate solution. Guys, it's a lot to this. And I'm just really giving it to you in like little simple terms, but it takes about 10, maybe 3 months, give or take, um, to really learn this. And a little bit longer. You just don't learn dialysis in 10 weeks or however many weeks the training class. I mean, you got to keep studying your craft, learning. You just can't go through the training and just use that and don't accelerate or expand your knowledge base on kidney disease because it's not that cut and dry. Again, you may have a technician that could have one of these alarms: arterial drip chamber alarm, venous drip chamber alarm, air and blood, temperature alarm, conductivity, and may not even know how to correct it. Okay, let me give you an example that happens that a lot of warriors um, don't even see, and it goes right under their nose: air and blood alarm. Okay, how many warriors seen technicians or nurses at your machine at the venous, where the venous chamber is, and they say they got air in your dialyzer? You see them hooking up a syringe on the end of it and aspirating the air out of the venous chamber and squirting it into the trash can, the air bubbles. Have you ever witnessed that? Have you ever witnessed uh, technicians or nurse saying that they had to change your dialyzer machine because they got air in it and they couldn't get it out? I experienced this because it happened to me during dialysis. I'm not without fault. Eh, There's been times where I had a little bit of fluid in my saline bag, rushing and not paying attention after I'm getting the patient on, not clamping that saline line, and the bag went dry. Medication went dry when I hung antibiotics. So this happens. The point is you got to know when this does happen, how to recognize it, and then ask questions to see if it's been rectified. Because when we throw your blood away, this blood is not coming back. And remember, many warriors are anemic. Okay, so if your blood is thrown away um, unexpectedly, you need to ask them to draw a hemoglobin hematocrit your next treatment to see what your blood count is. So again, these are some of the machine alarms, the common ones: arterial drip chamber pressure alarm, the venous drip chamber pressure alarm, air and blood alarm, which is very important. Air and blood. You can die if you get air in your system and the appropriate actions are not taken. Okay. Temperature alarm and the conductivity alarm. So, with that being said, uh, you got any questions? I'm looking at my Facebook feed, so I will be able to answer any questions or concerns, comments pertaining to uh, know your KT over V. Are you getting enough dialysis or machines in their alarms? And guys, look, let me tell you something. I'm not just making this stuff up. Okay, this information is from it's from the corpse itself. Okay, when I was working for them, I'm one of the type of workers that like to hold on to my information so patients to know. Patients didn't get this type of information, okay? They don't pass them out. And when they do, patients don't realize the importance of it and throw it away. Okay? I mean, it man, information is knowledge, okay? And it's very important if you're undergoing dialysis or if you have a family member that's undergoing dialysis to know guys. All right, I'm back. So, I tell you, this has been a great kidney disease education moment. This is our new platform. You may see some interchangeable um, be live uh, broadcastings, but for the most part, with World Kidney News and a lot of our broadcast shows are going to be from this format. So, just like to welcome everyone to our new format of World Kidney News, uh, produced on Urban Health Outreach Media. So, again, tonight's topics. Um, what was that? Tonight's topic. I don't forgot that fast, but it was the machine alarms and KT over V, knowing your numbers. Very two important topics that we discussed tonight, and I highly encourage if you know someone who's undergoing kidney dialysis that could use this information, please share this show with them. Join us this Tuesday at 9 p.m. on a special Warriors Quest 2.0 with Jared A. Brown. He's going to be talking about kidney transplant. Would you take a kidney affected with hepatitis C? Joining the broadcast will be myself and Scott Burton, kidney warrior out of North Carolina. So tune in this Tuesday, 9 p.m., right here on the Urban Health Outreach Media. So until then, guys, I may do a sporadic pop up of kidney disease education moment. I'm just in one of those moods, so I could pop up again later on tonight and do a midnight special. Who knows? But if I do, it'll be out there. You can always tune in and listen. It'll be something very tangible, especially if you're dealing with kidney disease or kidney dialysis. So I'd like to say thank you for joining us. Uh, as always, uh, your kidneys matter, and let me take us out with what the future holds for Urban Health Outreach Media. Good night and God bless.